name is Dr. Kathrin LaFaver. I'm a neurologist in Saratoga Springs, New York, and I have the pleasure of talking with Dr. Elizabeth Loder today. Dr. Loder is the Vice Chair of Academic Affairs in the Department of Neurology and a staff physician at Brigham Headache Center at the Brigham and Women Hospital in Boston. She's also a professor of neurology at Harvard Medical School and has been a mentor to many headache specialists in the field. So it's my great pleasure talking to you today. And we'll be talking about the topic of sexism in medicine. Thank you, Dr. Loder.
Thank you so much, Dr. LaFaver. I'm very pleased to be here to talk about something that I think is very important.
Dr. Loder, you were the speaker at our Women in Neurology third annual conference last month in Florida, and we're giving a talk on exactly this topic, sexism in medicine. And I think it was very helpful, especially for many younger women entering the field of neurology, to sort of hear that some of the experiences they're having are not unique to them, but are really, unfortunately, even in 2023, remain a more systemic issue. So to get us sort of started, could you define sexism in medicine for us and how you got interested in this topic?
You're absolutely right. Sexism is still there. It might be a bit more subtle than it used to be at the beginning of my career, but it's definitely still there. And I agree with you. It's nice for women, particularly those entering the field, to know that they're not alone. So what is sexism? Well, it's generally considered to be prejudice or discrimination against someone based on their sex or gender. And one thing that's important to remember is it's not always extremely obvious. It's not always intentional. I think most of us, I'd include myself in that, have sexist views. We may not always be aware of them. This is part of the unconscious bias that many of us have had training about. As one example, we're socialized, or I certainly was, to think of doctors as male. When a patient says, I saw a cardiologist, in my mind, I think that person might have been male. And sometimes I will say, what did he say? That's an example of sexism. So sexism can be internalized. It can come from any source, and we're all implicated in it. I think that's very important to remember. This is not a case of them doing something to us. This is something that is much more widespread and engendered in the society that we live in.
Yeah, I think that's really important to realize. Could you maybe mention some other examples, and specifically in the field of neurology, that you have encountered?
Yeah, well, certainly looking over my own career, and I'm at a point now where I can look at early, mid, and late career. Things were, of course, very different when I began. I would say that sexism was much more overt. Early in my career, very early, in fact, I experienced a lot of hostility from a boss. I ended up having to leave. This was, I believe, based on my sex. It turned out that leaving was a good thing for me, but it was a very unpleasant experience. I also became a leader in my professional society, and during my path to leadership and seeing other women attempt to make progress within the organization, I certainly saw a lot of behavior that I would characterize as rooted in sexism. To its credit, though, the professional society to which I belong, I think, has become one of the absolute most progressive societies out there. So the women within, I think, have been able to effect quite a bit of change within that professional organization. And then I dealt with a case of sexual harassment in my own division when I was a division chief, which gave me insight into institutional policies and procedures meant to deal with situations like that, which I think leaves something to be desired. That's changing, but certainly my experience in navigating the institutional procedures for coping with something like that gave me a lot of insight into things. And then now I work in academic affairs, and I see how likely or unlikely people based on their sex are to put themselves forward for promotion, how likely they are to believe in their own capabilities. I also work as a medical journal editor, and I see generally that women are more hesitant to proclaim themselves experts, to accept invitations to provide or write editorial commentary. Sometimes they do not perceive themselves as being expert enough to do so. So I see a lot of these things over my career.
Yeah, thank you for sharing. And I think it's important to realize that it's not just unidirectional, but sometimes kind of affects women and kind of goes both ways. So, as you mentioned, these issues are not always overt. And I think in recent years, the topic of microaggressions has become more of a term that has been used. Could you talk a bit about that? What are the microaggressions and how do they affect women?
Yeah, so the term microaggression has become very popular, and I think many people find it somewhat irritating. But that to me is inherent in what a microaggression is. So, microaggressions, by definition, are small things. It's hard to prove that they were rooted in sexism. Sometimes there's a lot of ambiguity about it. It can be as simple as, inviting a pregnant woman to sit down because you perceive that she needs to sit, or commenting on somebody's shoes or things like that. Often they're unintentional. Sometimes they come from a place of what we might term benevolent sexism, people trying to be helpful to a woman because they perceive that she's weaker or she might not be able to do something. Maybe she has family responsibilities. They think that they're being helpful. And these things happen when we perceive people to be different in some way, as women are perceived to be different, different in terms of their responsibilities in the home, different in terms of what we expect from them in the workplace. The problem with microaggressions is because they're small, each one of them, I think the temptation is often to say, oh, they didn't mean it. It's not that big a deal. It was just a comment on your shoes. If a woman brings that up, she's often made to feel, sometimes by other women, that she should just chill out. This isn't a big deal. And the problem is that they may not be a big deal in and of themselves, but when they are repeated over a long period of time, they can really sap somebody's confidence in herself, make her question her own competence, and can have a cumulative effect that is very negative. So, although I think many people are skeptical about microaggressions as an important contribution to how women do in the workplace and in other settings, they are, in my opinion, important. And I'll just emphasize again, they come from everywhere, including other women and, including colleagues who need to be helpful.
I know you have led a team of headache specialists and actually wrote a fantastic article about navigating sexism at work and how to talk or not to talk to your female colleagues. But could you share some tips for women how to navigate sexism at work, and specifically as it applies to our careers in medicine?
Thank you for calling out that article. It grew organically out of a Facebook group that I started called Migraine Mavens. I've worked in the headache field throughout my career, and I experienced something that to me was kind of discouraging, that I felt was sexist within our field. And I just thought, what can I do? And I thought, well, maybe there's some strength to be had in sharing this with other women, and maybe we should have our own social media community. So I formed this group, and after I gave a talk at the American Headache Society about sexism in the headache field, one of the members sent me a message saying, your talk was very timely. Immediately after you gave this talk, somebody stopped me in the hall and said, congratulations on your leadership position in the society, but are you really sure you can do this? Because you've got young children at home. And she said, so your talk was very needed. And people started just discussing within the group, oh, this happened to me, that happened to me. And we began to brainstorm, what could we have done differently? When these things happen, people are not necessarily prepared for them. And later on, at night, you lie awake thinking of what you could have said. And so we decided to write a paper. It ended up being published in the journal Headache, the Journal of Headache and Face Pain. And it was based on real vignettes from people in the group. We anonymized them so that people would not recognize themselves necessarily, but they're all real. They're things that really happen to women in the group. And we described the vignette, what happened. Then we explained, for those who need the explanation, what's wrong with this. Why is it wrong to tell somebody to smile more, for example? What could you do differently? And what could somebody who sees this happen do, the so-called bystander or upstander? If you witness something like that, can you help the person towards whom this problematic behavior is directed? And we came up with some examples. So for example, the all-purpose thing is, what did you just say? Make them repeat it, which often helps people to realize how inappropriate it is. And this got published as an article. It became quite the subject of attention on Twitter and elsewhere. I guess the term going viral would apply to this, but it included a lot of real world advice. And the thing I really loved about it was that it was written by the women in the group who had experienced these things. I guess I would characterize it as having been somewhat therapeutic. We got lots of messages from women in other disciplines, outside medicine, saying, "Oh, this happens in oceanography," for example. So I think what we described really resonated beyond the field of headache medicine and neurology.
Looking beyond the individual person, do you have any recommendations for medical institutions to share, in order to do better and maybe create an environment that is less sexist?
Yes. So I think a lot of institutions try to deal with the problem of lack of diversity, whether it's women or other underrepresented groups, by hiring. And that's one way to go about it. But I think retention strategies are also very important, and they need to pay attention to the work environment. Now, every institution now has guidelines about harassment, bullying, sexism, racism, and so on. In general, though, and I'm not speaking about any particular institution, but these policies and procedures are often crafted with an eye towards protecting the institution. And I would advise institutions to be a bit more genuine about this and not to think so quickly about what can we do to prevent the institution from facing a charge of sexism, or what can we do to deny or dismiss these allegations, towards thinking, what can we do to really and truly be helpful to these women? In other words, approach it from the point of view of trying to help the people involved instead of trying to help the institution. That will make a very big difference. I also think that citizenship activities, serving on committees, doing thankless tasks behind the scenes, and clinical work, seeing patients. Women are overrepresented among clinicians. And of course, we know that research and bringing in big grants is often prioritized over clinical care, despite what institutions may say about that in public. And I think those sorts of activities should be valued more highly, both in terms of pay, but also in terms of academic recognition. And with regard to the issue of salary, I would encourage institutions to publish salaries, or at least make them easily findable by people within the institution. I think there should be objective criteria for salary determinations. And the most important thing is, I do not think that women should be expected to negotiate their salaries. Women are judged differently than men when they attempt to negotiate salaries. It often backfires for them. It also is something that many women do not feel comfortable doing. And so waiting until somebody tries to negotiate a higher salary really guarantees and embeds and operationalizes sex differences in salary. So we need to move away from the idea that you have to be a go-getter, you have to ask for this raise. There should be objective criteria. Salaries should be revisited on a regular basis. And the kinds of activities that women do that are undervalued should be more recognized in terms of money and advancement within academia.
I couldn't agree more. I think, one of the other topics discussed at the Women in Neurology conference was sort of mid-career development, retention, and, career paths. And I think it's kind of known that a lot of women leave academic medicine in mid-career. And so I think these are excellent suggestions, and hopefully will help to make careers successful for men and women, right? Without needing to worry about being treated differently or unfairly. So thank you so much. This was a wonderful overview over this topic. And again, we will link the excellent article with a lot of practical tips, so people can really review that. And I think that's, again, it's been published a couple of years ago, but remains very, very timely. So thank you so much, Dr. Loder.
You're welcome, Dr. LaFaver. Thank you so much for asking me to speak on this topic. I really appreciate it.
Thanks, everyone. And this was it on behalf of Medscape, Tackling Sexism in Medicine.